just to get us started, we're going to do a little bit of learning about you all and your skills. How many of you have blogged before? Okay. How many of you have commented on others' blogs before? Okay. How many of you have Facebook? Okay. How many of you post photos on Facebook? Okay. How many of you have had a cross-cultural experience? What you would define as a cross-cultural experience? Okay. How many of you tweet? Okay. Okay. How many of you have worked on a newspaper as a photographer, editor, reporter? Okay. So a lot of this might be familiar to some of you, and we're going to use your expertise, so please give some feedback throughout this session. It's good to meet you. I'm Morgan. I work on a different part of the education and training team, and I feel lucky. I don't often interact with the master's or undergraduate students. I work with a training program for mid to upper level health professionals, so I feel fortunate to be here. Good to meet you.
And my name is Alyssa Zamora. Some of you already know me in the room, and some of you are finally putting a face to the Facebook friend, I hope. So I work on the communications team, and I write a lot of the stories that you guys read about in the newsletter, do social media, video, all of that good stuff. So it's good to meet you guys, and hopefully we can just get started. Yes. So agenda. So we want to talk a little bit about blogging and photography and video and some of the next steps that you'll want to take before you head out into the field. I want to give you some good examples of what works and maybe what doesn't, and maybe some tips on some ethical considerations that you should have. So first off, blogging. So blogging is a great way for you to share your experiences with the broader community, your family and friends, the Duke community, maybe even the global health community on a large scale. This is our DGHI Fieldwork Blog. We use a third party called Wordpress. How many of you guys know about WordPress? Cool. Okay. So we started this blog last year in anticipation for the students who are going out into the field. So we gave the students the opportunity to all blog from one place, which we thought was a very big benefit for the students going out. And last year, or throughout this past year, I want to say, we had about 14,000 hits to blog. So we think it was a pretty successful start, and we want you guys to be able to take advantage of this as well. So why blog? First off, it's a great way to just chronicle your experience from beginning to end, from the day-to-day details of implementing your fieldwork or research project on the ground to taking a step back and thinking about the broader takeaways, the broader lessons learned, your expectations versus the realities on the ground. So to be able to put all of this together in one blog. And again, it's a great way for you and your family and friends to follow you. And then last year we had students from 15 different fieldwork projects blogging with us on the DGHI blog. And so it was pretty successful. We had a lot of participation. And on any given day, we had up to 200 hits on the blog. And I say this because third bullet point, there are many people watching and reading. So it has a wider reach than what you may think. And then, are any of you guys certificate students? Yes? Okay. So for you, Lisa, why blog? This is a great way to get started on your GH Trips presentation that you're going to have to give at the end of the summer. And then I think the most important bullet is the last one. This helps you make sense of your field experience because you will get caught up in the day-to-day activities and implementation of your project. And so by blogging, this allows you to really take a step back and reflect on your overall experience. So what makes a blog successful? First off, they should be short. We recommend about 250 words, nothing too much longer than that. You want to keep in mind that the reader is not going to engage with just long blocks of text. It's just not appealing, and it's rather boring to most of the readers. Frequency. So some of the top hits on our blog were pages where students were blogging 2 and 3 times a week. And so in terms of frequency, we recommend blog as much as you can. If you have internet access, we recommend that you do that. And then conversational. We want you to keep in mind that this should be a conversation that you could have with a mentor or a good friend. When you write in a conversational tone, it's more relatable to the reader. So keep all those points in mind.
Along with your wording and use of images, headlines are usually what will draw a reader in. A few of the headlines from our blog so far have been, Beijing is cooling down, my passion for global health is heating up. The long-awaited final observation. Lights, camera, access to healthcare, that is.
And they can be a little cheesy, like the last one was a little cheesy, but at least it's something that kind of draws you in. You still want to read about it. Okay, so the key to good writing is good proofreading and copy editing. Before you hit that publish button, we want you to reread what you were writing about. This is sort of self-explanatory, obviously. But a lot of times we'll find that there are spelling errors or something is redundant or confusing. So make sure you reread. And once you hit publish, your blog post goes out to everyone who subscribes to the blog. So it's better that you edit before you press publish rather than editing later once you find that there may be something that you want to change.
What's one thing that stood out from your observation, from your day? What's one thing that you want people to take home? The more you can focus, the more engaged your reader will be.
And then in terms of show and tell, we don't just want you to tell us about your experiences abroad. We want you to show us, so add photo, add video. In one sense, it's a lot more visually compelling when you have photos there with it. People will be more likely to want to read your blog. And also, it's just a great way to bring your experience directly to the reader and give your readers more of a full experience of what is going on and what you're talking about in your blog.
Who would you link to? Consider for now that each of you are blogging. You know your sites. Who would you link to? Or you know your community partners.
I'd probably link to other bloggers that are in my same country. So Chelsea, for example, she's not here, but she's going to be in Nairobi. If she's blogging, we can link to each other for people that are interested in the geography.
It's a similar place. What else? One thing to, yeah.
I mean, maybe like within a post, if there's some like national thing going on or something that's affecting what you're doing, like a link to a news article about it or something like that.
Absolutely. And consider if your community partner has a website, and if you can bring traffic to their sites as well.
And I think it also sort of builds credibility on our blog that we're not just talking about it like these are real things and real people and real organizations we're working with, or our peers working on the same project or in the same country. And then commenting. So one of the benefits of having this DGHI blog is so that all of you can write about your experiences, but also when you're finished writing, you get to read about the experiences of all of your peers. We think this is really beneficial because you can learn about your peers' work, maybe offer a note of encouragement, ask a question. Some of the best blogs out there start a discussion. And so we're looking for you guys to start a discussion with your peers.
Can I have one project topic? Can somebody just tell me what they're doing?
I'm doing rapid diagnostic tests for malaria.
Okay, so thinking about rapid diagnostic tests for malaria, what are keywords that you think people interested in that might use? So in searching for information about rapid diagnostic testing for malaria.
Malaria itself.
So yeah, using the word malaria. It's very easy for us to replace it, that, but using the exact word, being as exact as you can. What else? We know she's in Kenya.
Location.
So yeah, each of your locations, even your specific community within there. So just think about what you think people might be looking for, but also think about what you want to convey. If you want to use more precise language and help inform people to be more knowledgeable about rapid diagnostic testing, use that.
And also, one of the reasons people use keywords so much, and I'm sure all of you know this because you are all bloggers yourselves, is it builds traffic to our blog. And so a lot of times, over the past year, we've gotten a lot of traffic from people who have nothing to do with Duke University, but they're interested in malaria in Kenya. And so they search on it, and our blog shows up. So it's a great way for us to really get our students and our projects and our work out there to the broader community. And so what should you blog about? I recently attended the Unite for Sight Global Health Conference at Yale, and one of the main topics that kept coming up over and over and over is storytelling. And storytelling in global health, and how by telling stories it's much more powerful than just simply writing down facts or statistics, or the fact that you did 10 surveys in the community today. That's not as effective as talking about a person you met. So how do you start off telling stories? You start with the interesting encounters you make with people in the community or part of your community partner organization. But the point of storytelling is to make a point and make it memorable for the reader. Sometimes storytelling can stir up emotions in someone, so it really makes it memorable in the long run. And so just ask yourself, what are the stories I can tell this summer? And if you meet someone who makes an impression on you, be thinking about how you could tell that story. A lot of times there's a three-part structure when you're talking about storytelling, and there's an introduction, so you introduce the person, and then there's a struggle. Let's say, a pregnant woman who doesn't have access to a clinic, and so she plans to give birth at home. Or an AIDS orphan who, up till this point hasn't had any education opportunities. And then a resolution. So what's happening now? Are you working with a community partner organization that is helping to get them better access to certain services or whatever? So tell those stories and talk to those people. And how is your work, how is the work of your community partner making a difference in these people's lives? So storytelling, I can't stress that enough. And then just generally reflecting on your experience, reflecting on your project. We talk to a lot of students who go out into the field and they're changed by their experience. I know a lot of you have already had some type of cross-cultural experience, global health experience. So how does this reinforce your passions and ideas about working in global health? And these are just some questions to consider while you're working on the field. Try to commit these to memory and be thinking about some of this. What strikes you? Again, interesting encounters, storytelling. And the third bullet is interesting progress on your project. We recommend that, once you're out in the field, after several weeks, go back to the first couple blogs and kind of compare notes. What were you saying in those first couple blogs? Has anything changed? Maybe, you've realized that you had to take a different perspective and approach your project in a different way, maybe to better meet community needs. So compare notes and talk about what's changed in the progress of your project. Again, more questions to consider. What are you learning? What are you learning about your project? What are you learning about the community, about global health? How is this complementing what you've learned at Duke so far? How is this shaping you as a person? We like to read about all of these reflections from all of our students who are out in the field. And then the third bullet is interesting, community voice. It's not just about your observations and not just about what you're learning, it's about the community and what the community perceives of you and your project. Are they working with you? How are they responding to your project? That sort of thing. And what does the community think is a priority? And do they think that what you're doing is going to help with a certain need that needs to be met? Go ahead.
I'm going to let you hold the clicker.
Okay.
So one of the things when you start thinking about blogging is also to think about not only the stories you're telling, but the people that you're telling stories about and the communities where you're working. So if we start looking at some of these things, the golden rule blog is you would have others blog about you. So you want to be thinking about how you would like to be portrayed if someone else were telling the story. If you were thinking about your project and you were thinking about the activities that you were doing, what are the types of things that you might want to be talking about?
I guess the people that you're meeting and interacting with.
Mm-hmm. The people you might be meeting, you might be working with in the larger community even. Everything that you post is public domain. Everything you put out on the web is going to be seen by everybody. So when you're thinking about your blogging, you need to be thinking about it as who's going to be reading it. So it's not just necessarily your peers, it's not even just necessarily the community. Think about it as though your mother's reading it. Think about it as though your professors are reading it, or the people who are evaluating the work you're doing in the community. So you not only want to think of this in terms of how you would want to be portrayed, but remember that it stays for a long time, and the pool of people who may see this, as Alyssa was talking about, is very wide. There isn't, in blogging, you don't get to say that you're only going to be able to see this part of it. If you are posting something, everybody can see all of it. You don't have privacy in blog. You can't put something out and assume it's not going to get back to other members of the community just because you have only seen one person reading it. And I think the third point is one of the most important points. Part of this is a learning process for everybody. Nobody expects perfection. But you need to be willing to admit mistakes. You admit mistakes if you've posted them in a blog. You admit mistakes if you've referenced something incorrectly, and do it at the same level that you've done your initial posting. So if you've said something and you discover that you're wrong, go back at the same level and say, I've discovered that I'm wrong. Andrew, you want to say something?
I did have an interesting experience with the know your audience element, particularly with blogging. When I was working at Novartis, we had a project in Tanzania, and there was an intern who was just an MIT intern who had come in for the summer, and she had gone to Tanzania to help part of the implementation of the project, and she was blogging. She had a private blog that she was just talking about the project, and was being very candid and frank with the interaction between the people that she was working with and the government associates that were helping us implement the project. And anyway, the project got pretty high level pretty quickly, and there was a little bit of a snafu at the government level, and so it ended up causing this kind of international incident, and her blog ended up in the New York Times. Because when the reporters were mining for, information, they used, like in the Libya incident, they used blogs all the time, and this 21-year-old girl who was just on her private blog, and that they attached a link to her blog in the newspaper article, which meant anybody could go back and read all of her college experiences, all of her high school experiences, every guy she ever dated, was in the New York Times. So you never really know how high up your words can get. So anyway.
Anybody else have any other
scary
examples of where something that they thought was going to end up in one audience ended up in another? It's a fairly frequent occurrence. The great thing about the keyword searches is that it allows us to expand out the people who are going to be able to see this. The other side of it is that it allows us to expand out the people who are going to see this. Good question. Which brings up, thank you, Andrea, I really like the segue. The concept of bringing some cultural sensitivity into this, and I know that some of us have already talked about this in other sessions, but just again, I want to, when you start thinking about what you're writing and some of the topics, we're talking about writing about frustrations or challenges you might experience on the ground. So this is something that you, going into your environment, might be writing about.
I statements reflect ownership, and that, I think, can be one of the most pivotal things on how big of an impact or what kind of impact you make in people reading what you're saying. So a negative impact or a negative statement can be tempered when you own it as, this was my experience, I perceived this happening. And if you have a question about how to process this, consider those that are good sounding boards for you in your academic experience. Consider your mentors, and then think about how to say that in your message, how to own it.
This can be a really tricky concept. When you want to write about something that's funny, funny is compelling, and funny can often be some of the best stories. But you have to be very careful about who decides what's funny in any community. And I will use a personal story to illustrate this. When I was a Peace Corps volunteer, we had a very important ceremonial first meal with the regional governor where I was going to be, and they prepared this absolutely fabulous meal that it turned out that I was allergic to, which I didn't know at the time. And I, doing my very best to be culturally sensitive and eat something I'd never eaten it before, didn't know I was allergic to it, knew I wasn't feeling well, but didn't want to offend anybody by not finishing the meal. The outcome of it was public and not pretty, and everybody on the ground thought that it was really funny. They thought that this was absolutely like the best, funniest story of this Peace Corps volunteer who was tremendously sick in a very public environment. I didn't find it funny. I really wouldn't have wanted it at that time, 20 years ago, when I was just trying to adapt it to be something that someone wrote about and put out on the web for everybody to talk about. It was embarrassing, and it was scary, and it was a new place. So from my point of view, not a funny story. From everybody else there, very funny story. When you're thinking about how you're writing, when you're thinking about the things that to you might seem funny, you need to be thinking about the fact that what your perception of humor is may not be the community or the person that you're writing about or the other people in the story.
Recognizing that the story is not only yours and your perception is only a piece of the puzzle. Think about how you can share it. So using I, using our, using their, and consider what makes sense, what's most appropriate.
Okay. Just a couple of tips. Some of this is fairly common sense, but just to put it into structure. When you're observing something and you're writing about it in the blog, you want to be careful not to use terms that can be labeling. And I was going to talk about a Peace Corps example because one of the things that was interesting for me when we were starting to put this together that I Googled and I found something, and apparently, although the technology is new, these particular situations clearly aren't. In 1961, a Peace Corps volunteer wrote a postcard, which she never intended to mail. After she finished the postcard, looked at it, decided not to mail it, fell on the floor, got kicked out the door or something, was found on a street. She was one of the new Peace Corps volunteers, 1961. She was in Nigeria. It had some less than complimentary observations about the community. The community didn't have running water. The community didn't have some other things, which to her were very, very strange and different, and which to the people in the community were typical and normal. And somebody saw the postcard, picked it up, brought it to her boss, who elevated it to his boss, and it eventually caused an international incident in which President Kennedy was involved. Stuff escalates pretty quickly. So you want to be careful when you're writing. Labels are culturally bound concepts. They're things that you have within yourself or that come from your own culture, you might not even realize it. So if you're writing about a meal, you might say the soup didn't taste the way you expected. You don't want to say the soup tasted weird. Okay, that's labeling. That's assigning a value to it. You also don't want to write about something without providing some context. If I'm going to talk about a community ritual in which there are trucks driving down the street and people are standing on them throwing beads off the sides of trucks into a crowd, if I don't talk about the fact that I'm in New Orleans at Mardi Gras, this sounds like a very odd cultural event. If you put it in context, it has a little bit more meaning. So you want to be careful when you're talking about things you've seen or done that you're putting some context around it. Morgan talked earlier, own your own perception of events. Those I statements are really important. What you're experiencing or what you're writing about, as long as it is clear that it is coming from you, it does mitigate effects that people might have where they are making assumptions when they're reading this. And then it's perfectly appropriate to talk about how your experiences have changed your views, again, if you're careful to own your views. And you talk about how the experiences have changed them. But again, keeping in mind that you don't own the whole story.
So we wanted to talk a little bit about some examples that we've seen on the DGHI blog so far. And so many of you may know the student who was working in Sri Lanka. These were some of his first impressions while on the ground. And so I highlighted a portion I'll just read out. The most impressive experience in the first night couldn't be something else but the continual weird sound, poochie poochie, from the roof of my hotel room. If you have been in rural Sri Lanka, you would not be as surprised as I was in the next morning after I confirmed that the sound was from a cute orangutan living in my room. So we just wanted to highlight this example. It has nothing to do with the student's project on fever, but it's still some nice description, and it helps to kind of paint a picture for the reader. And then this is another example. So this particular student was working in a clinic where they were promoting couples to get tested for HIV together. And so this student is just recording some observations that she had. When a particular husband and wife came in, the doctors thought that the wife may have HIV. And then most of the session was focused on the husband and his reaction, and the fact that he was reluctant to also get tested for HIV. So this is a good example of storytelling, I think. And then I want to read the last couple of sentences because, again, what's the point of telling a story? The point of telling a story is to raise awareness about some issue or shed light on something bigger that's happening, right? So near the bottom, it's not highlighted, sorry. It says, often in Loam, the wife will first learn that she is HIV positive, and in response, the husband will simply leave her without checking his own status. By encouraging the couple I met to be tested together, the counselors hope to stop that trend of spousal abandonment related to HIV. So why is the student telling the story? Because there's this broader issue of spousal abandonment related to HIV. And I think I just want to make one other point. So this was part of a long block of text on the blog. And so it would have been nice if she said, if she was thinking, oh, I think I want to write about this in the blog, it would have been great to also have a picture associated with this story. And then this is another example, kind of showing some community context. So the student in 2011 is in Sri Lanka and still witnessing the aftermath of the 2004 tsunami. And so this is just some good context, some good description of him writing about his observations. And again, it's great that there's a photo that accompanies the text. Again, it brings it kind of a full picture, a full experience for the reader.
Okay, so if we look at the highlighted, I'm curious to see, having talked about the tips, having thought about it, when you look at the highlighted portions or even within it, at least the kitchen and bathroom were clean and well equipped, while a room I visited with 30 infants was a bit smelly. Does anybody have any thoughts on the structure, the way that that was written?
It's very condescending.
Feels condescending. Mm-hmm. Anybody else? there are some interesting words. At least the kitchen and the bathroom were clean. You could question the use of the word smelly in there in terms of whether it was what was expected or not expected or what was striking about it, as opposed to just saying it's smelly, which again implies that somehow there's something really wrong with that setting. This one. Okay, just moving down to the second one. While playing with the cute children in the age 4 room, I was touched by them, but also impressed by their aggressive behavior, which should not belong to children of their age. Thoughts on the wording here?
Impressed is a really strange choice of words, apart from the obvious aggressive behavior.
Judgmental.
They're labeling like what children should, like what kind of behavior children should have.
You know what? And the person who's blogging goes on to give more information. My camel was almost broken in a fight. I was told that children are not designed to be bitten, gripped, or hurt in other ways by the others, and most of the children do not. Here's another one. Most children do not use the toilet appropriately by age in the age 4 room. So there is some context to this, which makes some of the earlier word use seem to maybe make a little bit more sense to someone who's reading it from the outside. But even so, you need to be careful, because all of you sitting here condescending, you know, there were tones to this, the way that the word choice was, that made it read in a way that the blogger may not have intended at all.
So then we just want to talk a little bit about our DGHI policy. We're going to be reading every blog, every word, looking at every photo you guys upload to the blog, but not to scare you off. But if there is any objectionable content or anything that's offensive or vulgar, you know, we do have the right to remove the blog post or remove the photo as we see fit. Now, we haven't had any problems with this at all so far, but we just want to kind of put this on your radar and just put it out there and make this known. Do you want to add something about this?
So, right. So we really encourage you, one of the most helpful things would be to consider having one public face about your global health experience or your fieldwork experience. We don't monitor what you have on Facebook, pictures or stories, but considering again the interconnectedness of what you say and who it comes across to and how it's perceived. So maybe think in your mind as you write on more private sources, even on if you tweet, what is my public face?
And so we kind of talked about what you should write about and some things that you can consider taking into consideration while you're in the field. And we want to also talk about how you can fit into the larger DGHI communications strategy or mission. So sometimes, and we've done this in the past, we've used content from the blog for other DGHI communications, including photos. These are some of the ways we use content. Highlights from the field. In the fieldwork section of the website, we have, in the students in the field section, we have a list of projects, and we typically will periodically throughout the summer, we go ahead and take a direct quote from your blog post and then copy them directly into your project page on our website, and then link back to your particular blog. So we're looking for like compelling information to put into the website. And so that way, people who are coming directly to our website may not know we have a DGHI blog. We can still bring traffic over to the blog. Feature stories. So we also have an e-newsletter that we put together every week, and we hope you read it and religiously every single week. And a lot of the stories that we do throughout the summer are your stories. And so I do want to say that we will notify you beforehand if we want to use any particular content from your blog. A lot of times I will contact you directly and maybe ask you additional questions or ask you to elaborate on something that you posted in your blog. And so we will be writing feature stories, and again, you will be notified. I want to stress that. And then this is the newsletter. All of our stories are featured in our weekly e-newsletter. And so now we want to talk a little bit about photography and video.
So on the first day or in the first week, when you're first getting to know your community, you want to talk a little bit about what kinds of photos you might be taking, or the fact that you're taking photos and why you might be taking photos. This is an opportunity to start building relationships, and you really ought to be building those relationships before you start taking lots of pictures of people or the community.
We will send you an email that has a photograph consent form, and we encourage you to print it out before you go. Make a number of copies. If you don't get written consent, be sure that you have someone's verbal consent before taking their photo and posting it.
So public versus private settings. When you're in a public setting, you're going to have a little bit more leeway. If you're taking a picture of a group event, like a health fair in Uganda or something, you're not likely to be able to get consent forms from everybody in a group. In a private setting, that's going to be much more important. But if you are taking a picture of an individual within a group setting, or if you have the opportunity, you should be trying to get consent whenever possible.
To respect privacy, consider about how you could frame a photo if it feels like it might be a sensitive situation, and consider framing it in a way that someone is not identifiable.
I do want to show you an example of what that might look like. So this is hanging on the 3rd floor. And this is a great example of a photo in a clinic setting, which is a sensitive environment, and the patient is not identifiable. This is a great picture. Why? Because it's still in this setting. You kind of get some idea of what's happening, what's taking place, and your words and the caption and in other parts of the blog will be able to tell the story more about this patient without identifying them. But again, some of the best pictures don't have to have faces in them.
Again, underlining what I said, building relationships before you begin snapping photos is really important. Photos, by definition, strip away context, offer only a limited point of view, and are only part of a story. So it becomes very important that you have a relationship with someone if you are photographing them, or an environment that you're going to be in. Again, public settings, you have a little bit more leeway, but building this relationship is going to make it much easier for you to have trust with the people that you're working with so that you can take these photos.
Be genuine, have fun, but we do encourage you to avoid staging photos.
Can somebody tell me rather than me talking, how might you let the community direct some of your photography?
If you're working with children, you can ask them where their favorite place is to hang out or stay. Maybe if they can take you to there, you can take pictures that way.
So asking, if you're working with kids, asking them where they might want to have their photo taken.
Like when I was in Uganda, mothers sometimes would come and be like, "Oh, can you take a picture of me and my baby?" So just people might just approach you and ask to get their photos taken.
Okay, so being willing to take photos that maybe you wouldn't have otherwise taken because they're at the request of the community members. Anybody can think of anything else? I have occasionally handed my camera to somebody and let them be the one taking the picture. It's not always me doing the choosing at that point what the images are going to be.
Similarly, just being aware of your power as a photographer, and considering showing images to the people that you're taking the photo of. If you want and you're able to follow through with it, printing out a photo or sending those photos via email, that is great. But also recognizing if you're not able to follow through to send a photo, to not make that promise. And just consider what your reaction could be if you're not able to send a photo and somebody says, "Oh, please, could I have that?" What are some possible things you could say if somebody said, "Oh, can I have a picture? Can I have that picture?" It doesn't have to be perfect.
I don't think I really understand the situation that you're describing. You've
Okay.
taken a photo of somebody and they want
Yeah.
you to send them a copy. Is that what you're asking?
So I take a photo, for example, of this group, and one of you asks, can I have a copy of this photo? And I know for me it's not possible. I don't know you, I'm not actually going to email you based on circumstance or based on reality. I'm also not going to print it out, or it's very unlikely that I'll come across you again. What are some things I could say?
You can ask them how you can get it to them.
Say again?
You can ask them how you can get the picture to them.
So you could brainstorm with them about how to make it happen. What is it that I could say if I'm not going to get the photo to you?
I'm just wondering whether they gave you initial consent to take the picture then. Because usually many people would actually ask for the picture if they give you consent to take a photo with them. And just don't know. I think you should get it to them if you're going to.
Right.
If you're going to take a picture with them and they gave you consent, then you should actually do it. If you're not going to be able to do it, then don't take it.
So maybe that's, a rule of thumb. If I'm not going to get the photo to you, then for me to consider not taking the photo in the first place. What were you going to say?
You could also show it on your laptop or if you have a computer so they can see it like big screen, so just on like the viewfinder here.
To show them in a bigger way? Yeah, absolutely. And also to consider deleting photos if there's a negative reaction. If somebody says, well, I don't like how I look.
But I also want to make the point that we like pictures, and whenever you can take a picture, whenever someone is willing to have their picture taken, you should take their picture, unless there's some other ethical reason why you shouldn't. But you can also point them to the blog and say, hey, I'm blogging at this website. If you have internet access, go take a look. That's where the picture will be, right? So you can point them to your blog.
So if you're looking at photos that have been taken, some of these questions you want to consider. Does the picture reinforce stereotypes? Does the picture inform viewers about the service learning experiences or about the experiences of the local people? So what is the story that you get just looking at that photo? Would you want your picture taken this way and put on a blog for everybody to see? And this last one, how can I photograph this scene using a symbol to represent my idea instead of directly photographing and exposing this person or place? So is there some other way than taking this image that you can get across the same idea? Either using a photograph that maybe shows part, the one Alyssa just showed you that doesn't show faces, but still gives a sense of the situation, or some image or sign that communicates the idea you're trying to get but does not in any way invade the environment. Is there some way to do that? All of these are things to keep in mind.
And then again, talking about our DGHI policy, we assume that anything that you take a person's photo, you upload it to the blog, we assume that you got the appropriate permissions to put it up on the blog, to take their photo, and to share it widely. Remember, this is going to be shared widely across the internet. Yes.
Say you're like in a school setting or something, and there's a bunch of little kids, and they're really excited to have their picture taken, but they're maybe 6 years old. Do you get consent from like a dozen 6-year-olds, or I mean, you're not there with their parents necessarily? How do you get what's the appropriate consent in that setting?
That's a great question. I think when they're not with their parents, I mean, obviously you get the parents' consent, because I mean, you ask a child, they don't really know what that means.
Right.
I would say if there's an adult, I mean, there's obviously some adult supervising the children, a teacher, an administrator. I would definitely talk to them first to make sure that it's appropriate to take photos.
So if we take a picture of somebody and we have verbal permission to take their photo, but we haven't explained to them that it might be on a blog, should we not put that picture on a blog?
I
they're okay with us taking their picture. I mean, if we have the picture, then which picture should we then not put on?
I mean, I think when you're getting verbal consent, I think when it's possible, you should tell them that this is what you intend to do with the picture. If you do intend to put it on the blog, try to convey that point. And you can also say something along the lines of, I want to tell your story, so that it's not just about you and you're taking this picture for your experience and your photo albums, but you're taking this picture to convey a point about their life or their community, community context. So whenever possible, try to convey that in verbal consent.
But if we don't,
intentions.
then we should not put it on the blog.
I mean, I think use discretion. If you're not comfortable, then don't do it.
I think I just wanted to kind of clarify, like, the picture you showed at the clinic.
Yeah.
Like, a lot of times, like, it's not appropriate to take pictures of your patients or even bring cameras to, like, a hospital.
Yeah.
And a lot of us are going to be working where, like, healthcare is being either, like, licensed or appropriated. So I think that with, like, regards to Lisa's question, even if a patient consents, or even if like, a participant consents in your study, is it appropriate because there are violations in America that wouldn't let you to put that picture up?
I also think that if you are working in a sensitive environment in a clinic setting, before you even bring your camera in there or even get a patient's consent, you're right. I mean, there are obviously other considerations. But again, as Lisa talked about on day one, when you go into your community, you talk to your community partner and let them know and ask them, do you think, will it be okay if I come and take a few pictures? This is my intent. I don't intend to show any faces or identify any patients. And obviously, you do what your community partner organization says ultimately. So, if you can't take pictures, you can't take pictures. Some of the students who blogged last year were blogging from North Carolina at a TB clinic, and they couldn't take any pictures the whole summer. And that's okay, because they couldn't. I mean, you're not going to go against what your community partner organization says. Is there anything to add?
I think that's a great question. And I think that asking yourself about what's appropriate in this culture, we're Duke, so in America, what's appropriate, what's permissible, and then having similar respect wherever you are is a great frame of mind. And to check any hesitations or any sense of power, but then also using symbols. Is there another way you can take a picture and put it on your blog if you're at a TB clinic in North Carolina and it be a picture of a tree that you walk past every day and that's your marker for your halfway to work, and you think as you go to work about the patients that you're interacting with, the cultural influences that help or are barriers to people getting care, getting medicine, taking their medicine daily. So you could have visual markers that are not of actual settings, but that's a little bit further from your question. That's a great question.
And then DGHI does have, can use photos, again, for other DGHI, the broader DGHI communications efforts. So we want to show you some examples of some photos that have been used in the past. This actually wasn't from the blog, it was pre-blog. So it's from 2009, a student working Project HEAL in Honduras. And so I want a little participation from you guys. What do you see in this photo? What do you see? Just yell out some words. What do you like? What do you don't like? Yes.
You can see service happening.
Service. Anything else?
If I couldn't see the photo, how would you describe it to me?
Anybody?
There's a level of energy communicated by the photo.
So there's activity, energy. Is it a black and white photo?
Color.
So there's color.
Gives you a sense of the community. from the visual.
So what's behind
There's
it?
a house behind.
Yeah, they are really moving. And the light from the water.
Okay, so what DGHI really likes about this photo is that there's great use of color. The student is in the photo. Whenever possible, we like pictures with students in them. And I know that's hard because it's your camera and you're taking pictures. But like we said before, you know, if you have an opportunity to give someone else your camera, that might be a good idea for you to get in a picture. This, to me, shows student engagement. This shows some aspect of global health, right? Education, service, you know, hand washing, sanitation. So when you're taking photos, think about, what does this photo say? What does this photo say about the community, the living conditions of the community in the background? What does this photo say about my project? What does this photo say about global health? And as I was talking about that we can use photos in future DGHI communications, perfect example. This is the photo, the cover photo of the 2010 Director's Report. So just know that your great photos are rewarded.
And they give credit.
Right.
Every time your photo is used, it's tagged with your name.
Right. And so our 2011 Director's Report is coming out soon, so you all should be on the edges of your seat waiting to see all those great photos in the report. And then this is a photo of Lisa Deng in the room, working in Uganda. We love this photo. But why? What do you see in this photo? It's great that she's a student. Yeah. Right. Okay. So again, this is similar to the first photo, right? It shows student engagement. It shows education. It shows, you know, working together, collaboration with the community. Great color in the shirts, right? And this is an interesting photo, a little bit different. What do you see in this photo? Color, right? Yeah, great use of color. What else? Expressive. Okay. Yes.
I think this one is more aiming to convey the community as it is rather than like the person coming in and what they're doing.
Right.
Like this is just, here's what it is on
Raw.
its own.
Right. Very raw. What else? Anything else?
I think it like invokes a lot of curiosity about where that photo was taken, like who that woman is, what is she making about.
Right. And so when you're asking yourself questions about looking at a photo, that's a great thing, right? It makes you want to know more. It makes you want to know this person's story. It invokes emotion. It's raw. It's real, right? And then this is another example of a photo that doesn't even have to include a face. What do you see in this photo? What do you like about it? What do you don't like? Anybody have any thoughts?
It signified partnership.
I'm sorry?
I said it would signify partnership between
Signifies partnership, exactly. Maybe trust, collaboration, right?
Intergenerational.
Intergenerational, exactly. Okay, great. And then this photo. This is an interesting photo because of the way the shot is framed. So if you think about a photo, and it's called the rule of thirds, you divide a photo vertically in thirds and horizontally in thirds, right? The woman, the main subject of the photo, is on the right third of the photo, and she has lots of like nose room and looking into the photo, right? And then the patient is at the bottom third of the photo. So consider framing your shot in a different way, not having the main subject of your photo always being completely centered. You know, there's different ways, unique ways to be able to convey your shots. And I think this also shows in the detail, she's wearing a rosary. So, you know, what is the influence of religion? Is religion important in this community? And then I think for me, what this picture shows is emotion, intense concentration, right? Delicate touch. This is a medical, I think a midwife, caring for a patient. and I'll just go through these. We like this photo at DGHI because, again, it has a lot of great color. And then it kind of makes you wonder why they're so happy, why they're so joyful. What are these papers in front of them? And so photos like these give you the opportunity to tell that story in a caption. You know, if you are not really feeling like you want to write a lot in your blog, just upload a photo and just tell us what's going on in this photo. Who are these women? What are they doing? Why did this situation or setting impress upon you? And then, what do you guys think of this photo? Any takers? Anybody?
What's the story you think this photo is telling?
John was either jaundice or experiment.
Hmm?
A child with jaundice.
A child with jaundice?
Child with jaundice. Okay.
Interesting. What else?
This care being given.
Care being given.
People are happy, so probably
That's
it's working.
The care is working.
Yeah, I mean, it's not a futile situation. There's some success.
The kind of facilities that are available in this community.
So this would work with maybe a series of shots, right? Wide shots, medium shots, close-up shots, shots with different framing, different angles. You know, we like candid shots, but posed shots are fine too, right? The point of this is bring us into your work setting. Show us what you're doing. So in addition to this photo, it would have been nice to see the student working, right? Or see the student working with this woman on the left. Is that person part of the community organization partner? Or is she a medical professional? Whatever, you know. So I feel like this would work better with a series of shots. But again, it's important for you to bring us into your work environment. What about this photo? What do you guys see in this photo? What?
Less color than the rest.
Which, I'm sorry.
Less color than
Less color than the rest. Okay. What else?
It's posed.
What? It's posed, right? And posed is okay. But candid can sometimes be more compelling. What else?
Maybe a family movie?
Family?
Yeah, it's kind of like a family, possible living life.
And also portrays the living conditions.
Living conditions?
Yes, the living there.
Yep. Good answers? Anybody else? So we would, I'm sorry.
Dressing style?
What?
Dressing style?
Dressing style. Okay, I'm glad you mentioned that. This photo would not be as good as the others to use because it shows nudity, child nudity. So I would shy away from something like this. But otherwise, it's a great photo, right? Especially if you tell the story of this family or if you know something about the family, share that information.
How could you crop this differently?
That's a good point.
The heads of the
You could just do the heads, yeah.
Do heads. What else?
Feet. Feet. Consider other body parts besides the face.
If it fits with your story.
Yeah, definitely. So just to kind of summarize, these are the kinds of things that we're looking for when you're uploading photos to the blog. Good lighting, high resolution. Try to remember to upload photos directly from your camera, like the original files. Don't go in, unless you're cropping something like this previous picture. Try to use the original files. We do like candid, but post are okay too. Again, capturing emotion, engagement, service. anything that says glaringly, this is global health or this is health related. And then you all will be receiving a DGHI t-shirt shortly. Yay!
Super glowing color.
That's okay though. It says DGHI on it. You're going to be representing out in the world. And so, you know, if you're taking your camera with you, wear your shirt.
Every day wear that shirt.
Wear that shirt every day. Don't wash it. You know, it would be nice if we could get some pictures of you wearing with you in it, wearing your DGHI shirt. But I mean, obviously it's not required, but it's nice. It's a nice thing to do. And then show originality. Again, the unique framing of the shot. Remember the photo with the midwife and the patient not centered. Maybe you want to tilt the camera. You know, get creative. You know, a lot of you are very creative. And then you can save these for your personal keepsakes and photo albums. Again, anything that's offensive, blurry, anything that is staged, no relevance to your project, the community, or global health, anything that shows stereotypes. And then we will be having a 2011 photo contest at the end of the summer, and we're all gearing up for that, and we're going to send you guys some details. More details are forthcoming. These are some pictures from the 2010 contest. These were the winners, but not that you need to do a photo that looks exactly like that. So while you're taking photos in the field, think about, wow, this would make a really good, you know, photo for the photo contest, and just keep that in your mind. And then we want to talk a little bit about video. So the one unfortunate thing about video is that you cannot upload your video directly to WordPress. We don't have that capability right now. So before you leave, if you want to bring a video camera with you, if you have one, if you want to rent one from Duke, you can do that. We ask that you set up a YouTube account. You guys are all familiar with YouTube, right? Yes. Okay. So set up your personal YouTube account, and then what you would do is embed the video into WordPress. And so I just want to show you what that looks like if you've never done it. So here's a video that we have on our DGHI YouTube page. And so basically what you would do is you go underneath the video to the share button, click on that, and then click on embed. And then it gives you this HTML text, and you just copy that and paste it into the WordPress blog. Okay. So a couple words and tips for videos. Again, like your blog posts, you want to keep them short, to the point, compelling. You know, and if you're thinking about what should I take video of, you know, think of, I mean, obviously action in your video is good. And you can think of like a CNN iReport style, like if you want to incorporate yourself and introduce the setting or what you're about to show us. So tell us what you're about to show us. Incorporate the community. Again, it's not just about you and your observations, it's about the community and their perspective. So if you want to interview someone from your community partner or someone you met who's really engaging and you'd like to get them on tape, you know, just put it on them, right? Okay. So these are the next steps. We all know that you are so excited about blogging with us this summer. So again, we'll be emailing you after this session is over, as well as all the people who did not attend today. Several things. First off, an invitation to access the DGHI blog and this presentation as a PDF in case you want to refer to it later. Also, I've written up some WordPress and blog instructions for how to access the site for the first time, you know, that sort of thing. And then the photo consent form, which Morgan talked about. We ask that you make copies of the photo consent form before you leave, so you have that ready to go for when the time comes when you need to get consent. Are any of you working on a team? Are you working on a team? Okay. You are?
Yeah.
Yes? Okay. Okay. So for those of you who are working on a team, when you get your invitation to join the blog, we ask that you designate one person, one email, to set up your username for the blog, so that we only have one username for one team, if that makes sense. And then for each blog post, you have to do two things. You have to categorize your blog post by year and also by your project title. Now, a lot of you have given your project titles to Lisa or Sarah, or maybe not. So I'm going to go in and update all of the projects in the WordPress system. And so if some of you had really long titles, I'm going to be shortening them, or it's going to be like the topic and the location, and that'll be your project title. So you're going to have to find your project title in the list. And I just want to show you a little bit.
Is that what we wrote down for you today?
Yes. If you'd like to change it, please feel
Yeah.
free. So did everyone sign the sign-in sheet? Did everyone sign in? Yes?
You can pass it back around.
Okay.
It's over on the sandwich table. Everybody can find it if they need to edit.
Okay. So I just want to give you like a quick tutorial. I know many of you are very familiar with WordPress, right? So this is what you will see when you first log in. And I had questions last year. I'm logged in and I can't find the DGHI blog. What do? I can't figure it out. So you just go up to my blog because you're using the DGHI blog, and you will already have had you will already be given access from me to access the blog. So blog dashboard. So this is the main page, right? And then you go up here where it says new post, and you can just do the new post from there. And so this is everything you need. And this is where you upload the photos, and then again for the videos, you just copy and paste directly into this main portion. And then, so the categories, remember, categorize your post by year and by your project. So this will show up on the right-hand column. I'm not sure why at the moment. Oh, there we go. So there will be a lot of projects in this list. And this is partially because it still includes all the projects from last summer, which has no relevance to you guys. But so you're going to have to go all the way to the bottom to find 2011. And so right now we have some projects that are currently going on still. And then I'll be adding yours. So you have to just do 2011 and then the project, and then publish this up here. You guys have any questions about WordPress? No? Okay, great. So I think that's it, right? Right, and the WordPress blog is dukeglobalhealth.wordpress.com, and to log in, you have to actually go to wordpress.com, I think /login, so it's different. And then before you leave for your trip, who's going in the next week? Or maybe 2 weeks, right? 2 weeks? Okay. So we're going to be looking for some blog posts before you leave.
I don't know, like, I have like a couple of projects. Do you want every project or nothing?
Do you have a primary project?
Do you only want projects that are taking place in developing countries?
She's doing an internship before she goes abroad for her field work.
Oh.
I was going to
She's
talk
at the
about
Who.
that, but I don't know if this is the
She's who?
Blog about everything.
I mean, if you want to, I think it would be appropriate.
Yeah. Okay, so before you guys leave, we want you to go ahead and blog your first blog entry. So introduce yourself, tell us who you are. Maybe you've had some global health experience before, maybe you're from another country. Tell us a little bit about yourself, about your project, why you chose the project, what you're looking forward to this summer, so that everyone can kind of get acquainted with you. And then don't forget to share the link. You have to share the link with all of your family and friends. And they can subscribe at the top right of the blog. And then again, these are just helpful resources. I think you can check out video cameras from Duke. I'm not sure, but I think you can. There's also a new book on visual storytelling from the Center for Documentary Studies. And I was just looking at it last week. It's really helpful information. It goes into into more depth about how you can frame a shot, storytelling, how to tell their story, that sort of thing. And then just a couple additional resources. Social media. So, any questions overall that we can answer? Nothing? Any other comments? Are you all excited about blogging? Yes?
How many of you think you're going to blog?
Awesome. Great.
Before I let y'all go, I do have a couple of quick announcements in relation to the things that we've been talking about. Those fabulous T-shirts will be available in my office as of May 3rd. So you can stop by. If I'm not there, Brian Phoebe shares the office with me, and he may be able to help you out as well.
You'll send us an email.
I'm sure he's really thrilled that I'm volunteering him for that. The second thing is I know that I've talked in some of the groups about these top 5 resource lists that we were putting together, that we're going to have things like top 5 films, top 5 top 5 books, music, etc. They're done. And I will email you guys the ones that are appropriate to the country where you're going to be heading, and we're going to try and put them up so that everybody can access everybody's, because you all will also be able to add to this resource as we go forward. And just because this is the first time that we've had master's students and some of the undergraduate students in the same room, can I just get you to raise your hands? I'm going to say what country, and if you're headed to that country, can you raise your hands? Because some of you guys are all going to be in the same country. And when we started this session, we talked about who you might want to be looking at the blogs of and connecting to. So if you're going to be in Kenya, raise your hand. If you're going to be in Uganda, raise your hand.
Wow.
If you're going to be in Sri Lanka, raise your hand. If you're going to be in India, raise your hand. If you're going to be in Nepal, raise your hand. Nepal? Know each other, amazing. Am I forgetting any countries where people are going to be?
China.
China. I'm sorry, Chris. I'm sorry. I don't think they have any Tanzania. Yes, Duncan, I'm sorry. Shame on me. Yes, I enjoy Tanzania as well. Okay, so you might want to take a couple minutes and just say hi and introduce yourselves to each other if you're going to be in the same area. Any other questions?
Will you email us when the T-shirts are here in case we forget that it's May 3rd?
Yes, I can do that.
I guess I could just put it on the calendar.
I'll send you an email.
Is May 3rd next week?
I figured out that.
If you guys have any more questions, just let us know. And you're also going to be getting an email from me with all of the stuff that I mentioned earlier. And so these are just our email addresses if we can be of any more help or assistance. Okay? Thank you.
Good to meet you all.